Hello, my name is Rafael Cortez.
And I'm Ethan Chang, and we are undergraduate students at the University of Michigan. We are pleased to present our research titled A National Survey of Expedited Partner Therapy in Academic Emergency Departments.
According to a report by the CDC from 2014 to 2018, gonorrhea cases increased by 63%. During this period, chlamydia cases increased to over 1.8 million cases, the most cases ever reported to the CDC. Additionally, the CDC estimates that 1 in 5 Americans had an STI at any given day in 2018. So, why does this matter to the ED? Well, STI visits in the ED have been outpacing the general rise in all-cause ED visits. ED see a disproportionate share of STI cases compared to other settings. Emergency departments diagnosed similar proportions of all gonorrhea cases as STI clinics in 2018. Moreover, STIs are an issue of social justice and health equity. STIs disproportionately affect those with low healthcare access, racial minority, and low-income populations. The same vulnerable populations which are more likely to use the emergency department for STI care.
Part of the issue in STI control is that the standard approaches for partner notification are inadequate. In areas of highest STI-related morbidity, partner notification rates were as low as 12% and 17% for chlamydia and gonorrhea, respectively. This is where EPT comes in. Expedited partner therapy is the process of treating the sexual partners of patients diagnosed with an STI without an intervening medical exam, and is used when a partner will not seek care otherwise. EPT has shown to be effective at breaking the cycle of STI reinfection. In a meta-analysis, EPT reduced reinfection rates by 29% and increased the number of partners treated per patient when compared to telling the patient to have their partner treated. In terms of legal status, EPT is legal or potentially permissible in all states but South Carolina. Lastly, many physician organizations support the practice of EPT, including the CDC, the American College of Emergency Physicians, American Bar Associations, American Academy of Family Physicians, and American College of Obstetricians and Gynecologists. Despite the urgent public health need and the critical role EDs play as a setting of care to combat STIs, little is known about the implementation of EPT in this setting.
Our objectives include characterizing the knowledge and beliefs of emergency physicians and operation leadership positions concerning EPT. Additionally, we seek to explore barriers and facilitators to EPT implementation.
We developed a cross-sectional survey to evaluate the knowledge, interests, acceptability, and appropriateness of EPT. Between July and September of 2020, the survey was distributed to 70 medical directors that were affiliated with the Academy of Administrators in Academic Emergency Medicine. Following the electronic distribution of the survey, we were able to calculate the proportion of ED medical directors that had knowledge and expressed interest in implementing EPT. Additionally, we used descriptive and bivariate statistics for primary analysis and multivariable regressions to explore predictors of EPT implementation.
48 of 70 medical directors responded to the survey. 73% of medical directors were aware of EPT, but only 38% knew how to prescribe. When it came to having implemented EPT, only 19% had done so. Despite low implementation levels, most of the medical directors, approximately 79%, supported EPT. For EDs that had not yet implemented EPT, 41% EPT was feasible, and 56% thought departmental support would be likely. Lastly, we found that increases in ED rates of Medicaid patients were significantly associated with increased support for EPT, while years in med director role was associated with less support.
This graph illustrates the perceived barriers to EPT and how much of a concern they were to medical directors. Legal liability, affordability of the medications, and intimate partner violence were most frequently cited as the highest level of concern. Additional concerns include misdiagnosis, adverse reactions, and complications with pharmacy.
On the other hand, most med directors rated potential benefits of EPT with high levels of importance. Over 75% of medical directors said that the potential benefits of EPT were either very or extremely important. These benefits were increasing access and treatment among marginalized populations, addressing untreated STIs, and preventing STI reinfections at play.
What we found was that academic emergency departments nationwide had low levels of prior knowledge or use of EPT. However, they had high levels of interest and reasonable levels of perceived feasibility of implementation. Increasing awareness of EPT and supporting ED-based implementation presents a key opportunity to improve reproductive health in marginalized populations.
Thank you so much for your attention. We would like to acknowledge the study team and the University of Michigan Emergency Department for their support in making the study possible. At this time, we will take any questions or comments.